Imagine you are laying in bed, feeling weak with aches, a congested chest, and a hefty cough that just won't seem to go away. You soon decide to call your dependable doctor, who says that they can make a house visit. Instantly, you feel relief from knowing that you will soon get the help that you need. Your doctor arrives and you close your eyes, awaiting a medicine that will restore you back to health. However, one simple moment of rest turns into your demise. So, why is this imagined scenario important to what I'm telling you today? Truth is, the scenario isn't really imagined. It is actually the experience of over 200 people. After researching my topic, I have learned a lot about the case of Harold Shipman and have come to question a lot about certain systems that have been set in place and the people that run these systems. Today, I'm going to explain to you why Dr. Harold Shipman is guilty. I will start by establishing Dr. Harold Shipman's background using information from the Britannica Online Encyclopedia. Harold Shipman, who is also known as Dr. Death, was a British general practitioner. For context, as a child, he gained interest in medicine as he witnessed his mother receive morphine injections while dying of lung cancer. In the 1970s, he graduated from Leeds University and became a general practitioner. According to the Australian Journal of Forensic Sciences, just a few years into his career, he was found to have been injecting himself with 600 to 700 milligrams a day of a drug called pethidine. Pethidine, which is commonly known as Demerol, is a narcotic used to treat pain. He then was admitted to a hospital and seen by a psychiatrist. Even with all of this happening and the General Medical Council finding out about his addiction, he still was allowed to continue his practice. Dr. Shipman's crimes are actually quite shocking. According to the Journal of Forensic Sciences, throughout the early 70s to 1998, which is the year he was arrested, Shipman is believed to have killed over 215 of his patients. But how could so many people have been killed without him being caught? Well, Shipman was very popular in his practice. Over the years, he gained many clients. He was friendly, inviting to many people, which I'm sure is why he was so popular. His final victim before his arrest in 1998 was an 81-year-old woman named Kathleen Grundy. Dr. Shipman had made a home visit to collect blood, that's what he said. According to the British Medical Journal, he forged Miss Grundy's will, stating, "I give all my estate, money, and house to my doctor. My family are not in need, and I want to reward him for all the care he has given me and the people of Hyde." Kathleen Grundy's daughter, Angela Woodruff, was very surprised by this, stated, "The thought of her signing a will so badly typed didn't make sense. The signature looked strange, it looked too big. The concept of her leaving everything to her doctor was unbelievable." This then led her to contact the police. There were two lead detectives on this case, Detective Postles and Detective Egerton. Many interviews were conducted, a search warrant was issued, and Shipman's computer was seized. A warrant was also issued for Miss Grundy's exhumation. After examining computer records, many inconsistencies were discovered in the medical records that Shipman had kept on his computer. It was concluded that Miss Grundy's will was a forgery, and the exhumation revealed that morphine was injected into the skeletal muscle. With this information, an arrest warrant was issued on September 7th. There were 11 more exhumations, 8 were used in Shipman's indictment. There were also 6 additional cases of victims that were cremated. He pleaded not guilty to everything. After further investigation, he is believed to have killed at least an additional 200 people. So, what was his tactic of killing? According to the Journal of the Royal Society of Medicine, he injected the victim with a lethal intravenous injection of diamorphine. He also signed a death certificate attributing the cause of death to natural causes. So, a lot of his patients were older women. So, anything, he used to say anything was a natural cause. Any sicknesses that they might have had, or just old age in general. This all would be the excuses he used on the death certificate to explain why they died. In previous victims' cases, it was discovered that Shipman backdated medical records. He did not make any attempt at resuscitation, and he had lied about claiming to call an ambulance. So why did he commit these crimes? Well, we can look at some just general information. 80% of his victims were female, and the youngest was 41. His motives are not known, and he never admitted to any reasonings. Some speculation is that he might have been practicing euthanasia to remove older people from the population. He might have gotten pleasure from his actions, knowing that he had the power of life or death over his patients. He might have simply just had a dislike for women. We're not really sure. According to the Medical Legal Journal, Shipman had lived an ordinary life as a once shy boy and had become a successful doctor with a wife and 4 kids. He committed suicide in 2004 in prison. According to his obituary, he hanged himself in his cell with his bedsheets. Due to this, we will never get to know the true motivation of his crimes. Dr. Harold Shipman is guilty because of his numerous murders, forgery, and medical violations. He violated his position of power as a doctor and murdered mostly vulnerable older women. He used his job to obtain supplies of diamorphine that he used to kill his patients and gain access to people's homes with the deceitful excuse of helping them. He used his trust gained from his clients and betrayed them, leaving the family of the victims distraught with the loss of their dear relatives. I would hope that you all agree on Shipman's guilt. Maybe you also now feel a little bit wary of the people that are in charge. The American Medical Association lists the first few principles of ethics for doctors as 1. Providing competent medical care with compassion and respect for human dignity and rights. 2. To uphold the standards of professionalism, be honest in all professional interactions, and strive to report physicians deficient in character or competence or engaging in fraud or deception to appropriate entities. And 3. To respect the law. To conclude my speech, I'd like to leave you all with a quote from the famed French philosopher and author Albert Camus to reflect upon. A man without ethics is a wild beast loosed upon this world. For my sources, I used the Britannica Online Encyclopedia, the article Intentional Harmful Violations in Patient Safety, the example of Harold Shipman from the Journal of Royal Society of Medicine. I used the article Editorial Dr. Harold Shipman from the Medical Legal Journal. I used Harold Shipman article from the British Medical Journal and Dr. Shipman Murder and Forensic Toxicology from the Australian Journal of Forensic Sciences. Thank you for watching my video.